Hello, I will be demonstrating a 3-view wrist x-ray. We will be taking an image of the right wrist. Um, Before I do my images, I would go through my AIDED and verify the patient's name, date of birth, and if it's a female, just make sure she's not pregnant. So verify like the last menstrual period date. And I asked the patient to kind of give me an idea of what brought them in, if there's any discomfort or pain, did they fall, just kind of assess what happened so I can better manage my patient. I would instruct them to take off all jewelry, rings, bracelets, any jewelry on the arm, hand or fingers, and we would also shield the patient. We put a shield in the patient's lap. So my technical factors for the wrist x-rays would be a 65 kVp, and my SID would be 40 inches. This is my image receptor. I'm going to use my cutting board, and we're imaging the right wrist. So I do have my right marker. Okay, so I would instruct the patient to flex their arm as straight as possible and lower the shoulder, and I would ask that they move the arm up just a little bit. We want the wrists and the fingers to be parallel to the edge of the image receptor. And my central ray would be directed right about here at the metacarpals. And so I'll make sure the patient's arm is not rotated. And I would take my image, I would collimate just to make sure that we got the wrist on all four sides, the wrist area, the metacarpals, and the wrist area on all four sides. So collimation is very important. My next view would be an oblique. So I would ask the patient to just raise their hand up a little so that we have like a 45-degree angle from the image receptor. And then my central ray again would be directed at the metacarpals. I would collimate, make sure I have collimation on all four sides here, and make sure my marker is in the image as well. And I take my image. The last view would be my lateral. I would make sure the hand is straight. Again, my central ray would be directed like at the metacarpals. I would collimate and take my image. So the anatomy we want to see is metacarpals, carpals, the distal radius, and ulna. Thanks for watching.